Hi, welcome to Fertility Talks. I'm Mary Wong, your host, and oh my gosh, I hear a reverb, so pardon me. Um, I'm a doctor of traditional Chinese medicine, and I'm the founder of Alive Holistic Health in Toronto, author of the book Pathways to Pregnancy, and your health and fertility coach. And tonight I have the honor of having Coleen Smith here, who was a registered nurse and is now turned into a doctor of traditional Chinese medicine. And let me tell you a little bit about her. And then I actually want to ask you directly. So first of all, thank you for being here and taking the time out of your day. We're going to talk about, oh shoot, we just lost you. Okay, let's see if we can have her show up again. Okay, all right, she's back. She's back. All right, so let me tell you what we're going to talk about. First, we're going to talk about endometriosis and how there can be pain or there may not be pain, but we're going to talk more and get into the meat of it. And before we do so, I'll tell you a little bit about Coleen so you really get that she's an expert in this field. As I mentioned, she's a registered RN, registered nurse, and she graduated from the American College of Acupuncture in Houston and did a master's in Oriental medicine, and then went on to train in China and Japan. And she's also a board certified fellow of the American Board of Oriental Reproductive Medicine, as well as part of the American Society of Reproductive Medicine since 2009 and was a founding member, I believe, right, of the Complementary Integrative Medicine Special Interest Group.
Yeah.
Which is awesome. And I personally try to create one, by the way, in the Canadian version, which is the Canadian Fertility and Andrology Society. But unfortunately, we're a little bit lagging behind, so there's not much integration yet. Some signs of it, so we're not going to let up. So hopefully, we'll follow suit like in the U.S. So thank you for paving the way. Actually,
it took a long time, Mary. It was hard.
Yeah,
it was hard, and a lot. We just kept pounding the drum. Asking people, come, keep joining us, and it was hard. It was a lot of hard work, but it's now happening. It's very exciting.
Which is so great. Yeah. So I don't know if I'm pounding the drum.
You can do it. You can do it.
I did a talk. I talked at the
oh wow. Yeah.
last year. And they were all like gung ho, all the nurses were awesome.
Yeah.
And then it just kind of like drop. So
the more acupuncturists that join and naturopathic doctors that you can get to join up and come, that's how you get the power there, because the societies, they want members. So if we can get more people to be a part, then they're game, because they want to sell tickets just like everything, like getting people in the door. So yeah, we got 100 people. We have over 100 members now, and that's pretty exciting in our special interest group. I mean, the nurses have thousands.
Yes.
And so we're trying to make sure that, but it costs $10 every year, so it's hard to get people. You have to be on top of your membership. So if they're membership of a nurse and then their membership of the Endometriosis Society, that's already $20 extra.
Right.
So then to join the Complementary Integrative Medicine group is another $10.
Right.
So you can't be after the people who are already there. You've got to kind of create another wall of people.
And it's so true. But when I was going through, and now this is a whole different conversation, so maybe
I know.
Take it off offline.
Yeah, exactly.
We're trying.
Yeah, very good.
Anyway, I want to just shine light to the fact that you've been and currently still working on a text, and you're currently co-writing a text on PCOS, meaning polycystic ovarian syndrome, and endometriosis for healthcare professionals. So that's amazing.
Yes, the text is mostly for nurse practitioners and physical therapists, as well as acupuncturists. But our target audience is actually Western docs, because we're finding that in America, what's happening right now is that nurses and nurse practitioners are taking on this as a acupuncture. They think there's a need. Well, I've met with nurses repeatedly, and the need is growing. The research is growing that we need this. So nurses are taking it in their scope of practice. And so if they're going to be doing acupuncture, we need to train them, or at least give them some tools that they can use effectively for women with PCOS and endometriosis.
Which is so great. And so our topic is on endometriosis, and perhaps on a later date we can talk about PCOS.
Yeah, great.
Okay, so the very first thing then, let's go straight into the topic. How do you diagnose?
How do I diagnose? Well, in acupuncture clinics, it's great because you can meet with them and talk with them a long time about their menstrual cycles. We talk so much about the quality of their blood and the frequency and the pain. And it's nice for women to be heard, because with endometriosis, the first thing that women come, as you know, Mary, they come in and tell you their story, and they've been told by other physicians or by other professionals that what they have is just normal. It's normal dysmenorrhea or painful periods. And so they can have painful defecation or painful sex in certain positions and with deep penetration, or just painful pooping when they're right before their period, or really loose stool right before their period that's just like diarrhea for those first few days. And docs just don't take, or frequent UTIs. All these are clues for us as holistic practitioners. We can say, okay, and so I have these questions all on my intake, and I'll say, do you get frequent UTIs? Because that's telling us right then that perhaps there's a change either in the function of the way they're producing prostaglandins, or meaning, are they more sensitive to allergies? Like your body's more allergic to things. Is your immunity? Do you have immunity issues? So yeah, that's where our diagnosis hones in on some of those specifics. And I can say to a woman, I know that endometriosis can only be diagnosed by a camera going inside and looking at you. But as a holistic person, we can say, this looks like you have a lot of endometriosis signs. Right. And that makes them feel validated, because they're like, yeah, I've wondered, but my doctor says, of course, you're fine, or not fine, because I'm not trying to minimize what the physicians are saying, but they're not going to just take people to surgery and put a camera in there if they think they can sustain the pain that they're already doing. If a person says, I've had pain since I'm 14 and I'm now 32, they're going, well, you managed, right? So here's some muscle relaxants and keep doing it.
Exactly. So, and again, not to minimize their position or what they're doing. It's like they only look in their toolbox, and what do they have, right?
Yeah.
So either painkiller, anti-inflammatory, or surgery.
Right. Yeah.
Fantastic.
Absolutely. Yeah, fantastic. How's that going for you?
Yeah. But it's not digging into like, okay, what is it? How are there methodologies that we can utilize to help? So, which brings us to, what can help? Like, are there supplements that can help?
Yeah, I do. I use a lot of supplements in my practice, not just Chinese herbs. I use Chinese herbs too. And you know as well as I do that as acupuncturists, we have great Chinese herbs. It's like magic. Like, I feel like the ancient Chinese secret. I pull it out of my basket. Oh, you're going to try this, and they go, oh, I've never had a better period. So it's very fun, because we have Chinese medicine that does that. And so I encourage patients who I talk to on the phone or do phone consults with, get to somebody who practices Chinese formulas. You don't want people diagnosing you from far away. You want somebody who's looking at you and checking your tongue and your pulse and seeing what they see and then treating what they see. But for supplements, what do I use? I use NAC all the time.
Yes.
And I tell people on my podcast, I tell people all over, NAC can't be missed. makes the body more sensitive. It helps improves the immunity. There's great research that it decreases inflammation. So NAC is one of my go-tos. What else?
And at what dose?
Pardon?
At what dose?
Oh, at what dose? 1,000 milligrams twice a day, usually, morning and night.
And then are you also having them take it when they're pregnant?
Yeah, NAC is great. It's a super antioxidant. It helps with a lot of chemical reactions and enzymatic reactions in the body, so people can take it safely through pregnancy. I also have women. Now the rest with endometriosis.
Sorry, I'm going to stop you for 1 second. There's a lot of reverb. I don't know where your mic is.
Yeah, I hear it too, actually. I don't know. Is that better? I think it's here. But. There, is that better?
Let's see. Yeah.
Is that better?
Yeah.
Okay, good.
Okay. Perfect. Okay, let's go.
Okay, good. I'll just take that right out. Okay, so the other supplements that I use, and this is kind of my own little secret, is cordyceps. I use cordyceps a lot for endometriosis, and that's because I read a long time ago when I was preparing for a topic that I was speaking at the ASRM on uterine linings. I came across a paper about cordyceps, which is a triple mushroom, that it was not only really good for reducing cancer, but it was really good for decreasing inflammation. So I started using it for my endometriosis patients because of their high inflammatory markers. And almost everybody responds so well to it and starts feeling so much better. And they have way less pain with their periods. So now it's kind of one of my go-tos in my toolbox. Mm-hmm. So yeah, cordyceps, NAC. I'll put people on enzymes because bromelain and quercetin, anything with polyphenols, which is anything with bright colors in vegetables and fruits, they're all super important. So I'll have them take anything. I don't make people buy a bunch of things, so I have them eat really well. Mm-hmm. And try to take an approach of, okay, drink pomegranate juice and eat oranges. Oranges are particularly good for women with endo. There was a lot of research back in 2008 about tomatoes, but tomatoes kind of are a double-edged sword. They're high in histamine reaction. They cause more histamine, and yet lycopene, that's one of the active ingredients in tomatoes, decreases endometriosis pain. So it's kind of like, do we give them tomatoes? Don't we give them tomatoes? And it's kind of a no. I don't give people tomatoes, but I do have them do more polyphenols, which is the color. So what's good in the tomato? That nice bright color. So find it in something else. Take some reversatol, drink some pomegranate juice, do some OPCs. Everybody has a favorite anti-inflammatory that they like. And so I have them take lots of them, vitamin C extra. And another thing that I do with a lot of my patients that I don't hear other doctors do is fiber. And, I knew this and taught this as a nurse. I taught fiber. You want to regulate cycles? Use fiber. Use more fiber, supplement with fiber. And, that goes back to the gut going to regulate the hormones. Use fiber and probiotics, and your hormones are going to get better. Because if you're getting 90% of your signals coming from the gut to the brain, then you need to eat properly, and that starts by eating more fiber. So I start people on fiber all the time. So cordyceps, fiber, NAC, probiotics, we kind of go from there.
Okay. Yeah, don't name everything, because of course people will watch this and they'll take everything, right?
I know, I'm sorry. It's kind of like one of those, I always start with one or two, and then we build if it doesn't improve. Just start it, do a cycle, see how you improve, then do another cycle. Yeah.
Exactly. Because if you take everything but the kitchen sink, you have no idea what is doing what.
Right. And then they start feeling overwhelmed because because then they're like, I'm taking all this stuff and I feel better, but I can't afford it. And you know, so.
Yeah, that's great. Okay. So then to back up, cordyceps, how much are they taking?
You know, the cordyceps I buy from Mayway, or I buy from Evergreen. And so basically they are offering three times a day. And I tell people to start with 1 or 2, and then 1 or 2 twice a day. So I have them take not even a full dose, half a dose, not very many, and just see if that's enough to make a change in your cycle. It's very specific. Cordyceps works very specifically on that prostate for men and on the cervical area for women. So when I started reading about that, I was like, you know, this is just going to be they're going to come out with more and more research on it.
Right. So if you could direct us to a specific research paper, that would be awesome too.
Oh, well, I'll look, and then I'll put a link out there for you.
Yeah, that's great. Yeah, exactly.
Yeah.
Well,
okay.
After the post, you could actually add in a link if you have it.
Sure, that would be great.
And then we'll link to your website as well.
Oh, thanks.
If you have more information on that. Okay, great. So what else can one do?
What else did we talk about? I can't even remember. What else? Oh, I do acupuncture, of course. I think that getting acupuncture 3 times a month for endometriosis pain is ideal for the first. Now it depends on what the level of pain is, because some people with endometriosis are missing work like 4 or 5 days a month, and if that's the case, then after about 3 months of treatment, I haven't had patients who can't get back to work. We are really able to manage people's pain very well. I had one young photographer that I've been seeing, and I bet within 2 cycles she got so she wasn't missing any work. And then after she still went and had her surgery done, because they were going to go in and do a clean out and get rid of all these endometriosis spots. And they did that, and they found less than they thought they had, but they also found interstitial cystitis at the same time, which was another whole new problem. Right. But we had eliminated all her pain by the time she went for surgery. So it was pretty cool. So acupuncture is so amazing at reducing pain. You know that. So
yeah, I remember one lady who we were treating her for fertility. Of course, it's like within 2 months, she says, "Oh my gosh, this is 20 years I've been living with pain, and now all of a sudden it's gone."
I know. And that's the best part as acupuncturists. People always say, you know, and I've read so many of our colleagues who will say, oh, well, you know, for PCOS or endometriosis, acupuncture is not the only answer. And I think, what are you talking about? It's the only answer. It's great. It is great. It is. It's fabulous. It's just never let me down. So I just love it.
And I like what you added, though. It's because I do believe in the power of integration. So certainly at times we may not need any kind of other intervention outside of what we're doing. But there are times when it can be beneficial to do surgery, right?
Right.
And sometimes it's just, it's pervasive, and, you know, if it's adhering to the ovary or like the fallopian tube, we need to do something. I mean, we can, I don't believe that any one medicine is
absolutely. Well, you know, I was a nurse, and I was an emergency room nurse for 17 years. And as a woman, I had endometriosis and PCOS. So living with all those symptoms, sometimes you realize that there is nothing else that works except for surgery. Sometimes you try everything natural and you still end up having to do things. And it's not a failure of the person. People aren't at fault for having disease, yet we all need to work together to make people pain-free and get the best outcomes we can. So I'm all about integration.
Thank you. Yeah, and I think it's such an important conversation, just because certainly we see people that come in, I'm sure you see it, where women are like, I'm all about natural and that's it. And at some point, we might need to reconsider and look at other things too.
I had that case just this week, a 28-year-old girl that has been seeing a doctor for 1.5 years, and she's 28 and not able to conceive. And I said to her, you know, I really want you to do what this other, and I sent her to a different physician that I want her to see, a reproductive endocrinologist in the area. And I said, I really need you to listen to her, because if you don't, we're going to have a lot of trouble getting you to the end goal, which is conceiving, because sometimes it's required that you're going to have to take a medication or you are not going to get there. So yeah, I mean, there are things we can use instead of metformin. We might be able to get away with a Visitol, and instead of, you know, a drug, we can use fiber and get people to reduce their inflammatory markers by 75%. But sometimes your endometriosis is so pervasive that the only way to clean it out so that you're actually going to have less inflammation and get pregnant is by having a surgery first.
Yes. Yeah. And, you know, when we're not going to undermine the grief that may go with it, because, of course, you know, there's this ideal of I'm going to do everything natural, and then I surrender to a pervasive surgery.
Yeah, yeah. And you're right. And sometimes it just is reconciling that this is not your body letting you down. This is just the way sometimes disease takes us. It's ahead of us sometimes, you know.
And then on the flip side, I want to speak to the women that think, oh, surgery is the only answer.
Oh, the opposite. Yes. I go, no. It's the last answer.
Exactly.
Yes. No, try everything first. You don't want to go in there and scar up anything. I mean, right now, everything on our body is made the way it was made. So to putting an instrument inside and moving things around causes scar tissue, causes problems. It changes the flow of energy. And we are energetic beings. And so we want to leave everything as natural as absolutely possible. So yeah, I'm for that. You know?
Yes. So that first, by the way, for people joining in.
Yeah, absolutely. Natural first.
Natural first.
Yeah, and taking a really integrated, holistic approach. But when that doesn't work, you then open the chest and say, okay, what else can we do? You don't go, okay, well, that's it. No more for you. Sorry. You know, that's all.
Right. Yeah. Thank you for addressing that. Okay. So where do we go for help? You have endometriosis, or actually, you know, you have an inkling that something is wrong. Where do you go?
Well, like we were just talking about, when there's something wrong, or people are having painful periods, or painful sex, or frequent UTIs, or pain with deep penetration, you know, of sex, or just a few days where they're so nauseous they can't work. Sometimes that's just endometriosis that has caused those markers in the body, that PGG. It's that same that I was talking, those allergy markers. Our body goes into like fight or flight, but it's not really that. It's just your body starts to put off these things that cause us to feel really sick, and we'll get super nauseous. And some women, nausea is the only sign that they have for many years. And so, and that, yeah, also infertility. Sometimes infertility is the ultimate sign that something's wrong. So where do we start? We start with acupuncture and herbs first, or supplements and herbs first. And then, but acupuncture is the fastest way to recovery quickly.
Agreed.
Yeah, the fastest way is me and you.
Yes. Yes.
Saying, okay.
And I always say, you know, acupuncture is like cheating.
It is.
Because you just go and you get done unto, right? Versus going on a diet and exercising, all that, which of course I say is very, very important.
I know, but I say this little needle is, you're exactly right. It's cheating. You take that little needle and you just cut right to where you need to be. It's just awesome. Yeah.
Yes. And you know, for those who are watching, who've never had acupuncture, we don't cut into you. You said the word cutting.
I say you're taking this tiny little, hardly noticeable filament, and you're connecting your spirit to your emotional and your physical, and you're tying them all together. It's very cool.
So, you know what, on that, when you're talking about the emotional and the spiritual, do you have any insight in terms of the connection between endometriosis and the emotional piece?
Well, you know, that's a very great question. Endometriosis, I'm not sure. I don't know how to answer that fairly because there's so many different walks. Like I would say fibroids, yes, I'd say those are always blocks. I always look at fibroids and lumps and polyps. I always go, oh, those are blocks in people's lives that they've put that block there, or they've carried it with them and they haven't been dealing with something, so they just put it into a spot and your body creates a lump. Endometriosis is more diffuse and maybe more of a energetic pain that we store in all over. I don't know. You know, I don't know, Mary. That's a good question. I'm not sure.
But I like what you said about the blocks, which I agree with. But I would also add in, you know, because they will say that there's a higher tendency for people to have some kind of a genetic component. But really, is it genetic or is it transgenerational?
Very interesting.
Blockages.
Well, right? That's very good. See, I hadn't really. That's a very good point. I've not heard that, and yet when I think on that, I think I like that. That resonates very well as far as I bet there is something generational because there's a high familial component to endometriosis.
Mm-hmm. So, and PCOS, yeah.
Yeah, well, PCOS too, yes.
Yeah.
PCOS, I see more of that bad eating habits and bad ways of coping with things. And so then you can see, oh, this envelops all that and then creates a problem. But endo's different for me because I think, well, that didn't come because you ate wrong, or, you know, whereas with PCOS, we go, oh, well, they were eating wrong, you know, they're insulin resistant and they're eating too much sugar. And so you see this pattern emerge that you go, oh, well, or there's too much testosterone, or maybe your mom didn't do this right when she was pregnant. So we kind of can put the blame in different spots. But with endo, it's kind of like, you know, like, but I like that generational thing because you're right. Big family history of too much, producing too many inflammatory markers and genetic. And, you know, in endometriosis, there's several theories on how it is formed. And one of them is that the cells that are lining many of the organs inside the pelvic cavity and around are just not developed properly. And so that could be something that has passed on genetically from mom to daughter or dad to daughter.
That's right. We can never forget about the male component. We always forget about them. So thank you for adding that in.
Yeah, dad to daughter.
Yeah, absolutely.
It was his pain that brought it to us.
Yeah. That's right.
Yeah.
Blame it on dad. Okay, exactly. Cool. All right. And any other words of advice in general? I mean, this is called Fertility Talk. So really, for those that are having challenges in fertility, and by the way, I tend not to use the word infertility for those who are watching because I believe that it's a difficulty in the moment of time, and I don't think it has to be permanent. So I just call it fertility challenges.
Yeah, I like it. I was talking with somebody today, and I said she was down because she said she keeps getting bad news from the doctor, bad news. And she said she's just worried because today was a day when they might be hearing news from the clinic. And I said, the wonderful thing about only receiving bad news, there's a wonderful thing about it, okay? And that means this too shall end. I said, every record that's ever been made, everything that's ever happened to people, all comes to an end. So if you're getting bad news, just know today might be the day that this is no longer going to be the case. Somebody's going to pick up the phone, you're going to turn around, and all of a sudden you're going to be at a different place, and there's going to be good news happening. I go, records like that are just meant to be broken. So it's okay, taking a breath and understanding that that it might not be the same as yesterday is the best news we have. Like, our future is not dictated by our past.
Yes.
And it's very cool to know that no matter what's happening, there's always another option coming down the road. And that's when we have challenges like this. That's what's cool about this medicine, is there's always something new coming down the road that's going to help us.
I love it. And it's like a new pathway.
Yeah, it's cool. And, you know, I remember a very difficult time in my own life when bad things kept happening in the fertility world. Like, you'd want this to happen and it wouldn't. And there's no eggs, or there's no embryos, or, you know, there's no implantation, and then there's no lining, and it just goes on. And that is just I always say that's a record waiting to be broken, you know, because all of a sudden something changes, and then something else changes, and then something else changes, and pretty soon you have 6 children, right?
Right. I want you to actually tell people your little story in like 20 seconds.
Okay. You want me to tell them, or
yes? Yes.
I at the age of 27 gave birth to my daughter. I had trouble conceiving, I thought, because I didn't get pregnant instantly the first month, but I got pregnant within 6, so I did not have much trouble. I found out later in my life, when I had a hysterectomy, that I had endometriosis very, very badly, and I had PCOS, and I had adenomyosis, which is a complication of endometriosis that causes scarring and overgrowth inside the uterus. I wasn't ever able to conceive again after I had my daughter. And I did adopt 5 more children. So that's why I say sometimes the road takes you a different path, but it doesn't mean it's just a different path.
Amazing. Thank you for sharing. I have one, and don't judge me because I have not adopted.
No judgment. No.
So thank you for being here, and thank you all for watching, and please share the post, and certainly you can go scroll down. There's a lot more posts, all fertility related and life related, really. And for those of you that are private, go on to marywong.life and go under the video section and subscribe, because we transform all of these interviews into YouTube videos. So subscribe to my YouTube video. I never know what the name is, so just go onto my webpage and subscribe. And then you'll just get it. So awesome. Thank you. And I would love to have you again, and we'll have that conversation about PCOS and how you want to contribute in the textbook that you're writing.
Thanks, Mary.
Okay, thank you. Have a good night. Have a good night, everyone, and we shall see you next time. Okay, take care. Bye.
Bye.
It doesn't want to end.